Thank you, Mr. Chairman. First, one of my colleagues advocates Medicare for all. I'd remind her that people spend a lifetime paying into that system before they qualify, and even so, they'll end up drawing about 3 times more out of the system than they pay in, which is why the actuaries are warning us that that system is in imminent danger of collapse, and I can't think of anything that would collapse that system faster with all of the elderly people who depend upon it than what the gentlelady has just advocated here. The state of California, which is the most radical left state in the country, has several times considered providing a Medicare for all at the state level and blanched at that at the price. Mr. Ippolito, the 2 sectors of the economy where prices have increased much faster than inflation are tuition and health care. Why is that?
Well, I'm not an education economist, but there's certainly some similarities. Among other things, they're fairly heavily federally subsidized, which lowers the cost.
We pour tons of money into it, and they're happy to accept it. Is that essentially what's going on?
I think one could characterize that as a factor. Yeah.
Let me read you something that Milton Friedman wrote 23 years ago. He said, quote, "Since the end of World War II, the provision of medical care in the United States and other advanced countries has displayed 3 major features. First, rapid advances in the science of medicine. Second, large increases in spending, both in terms of inflation-adjusted dollars per person and the fraction of national income spent on medical care. And third, rising dissatisfaction with the delivery of medical care on the part of both consumers of medical care and physicians and other suppliers of medical care." Have things gotten better or worse since he wrote that in 2001?
It'd be a tough case to say it's gotten much better. We've had many advances, many technological advances.
In technology. But as Milton Friedman also pointed out, in every other sector, as technology advances, prices go down. Has that been the case here?
No, not in general.
So spending has gotten higher. Dissatisfaction with the system has obviously gotten greater. If that's the case, despite massive increases in government spending and regulation, maybe that's what's causing it. All of this government intervention and spending that's made costs higher and services worse. That shouldn't surprise us. That's what socialism always produces, higher costs and worse services. Let me ask you this. What role does illegal immigration play in driving up healthcare costs?
I'm not an expert on this issue, but the key things that you would have to think about are what kind of resource use do you see among that population and how much does that cost?
Well, let me tell you what they are, because the Federation for American Immigration Reform just released a report on that. We had a hearing on it just a week or so ago, estimating the cost of care for illegals is about $22 billion a year. Who ends up paying that $22 billion price tag?
Well, some combination of the people who receive services, the Medicaid program potentially, and then providers in the federal government in the form of uncompensated care.
Before we socialized our medical system, we had a free market system in which every American could choose from a wide variety of competing options, the one that best met their own needs and budget. They owned these policies. They could change them at will if they became dissatisfied with their coverage. And they had a huge incentive to live healthier lives. For example, an obese smoker paid higher premiums than someone who kept himself healthy. An elderly couple wasn't forced to pay for maternity care. A young family could choose to purchase low-cost catastrophic insurance and then pay for incidental expenses out of pocket. So explain to me why we shouldn't just start over, scrap this entire mess of a system, allow people to deduct their health costs from their taxes, provide the poor with a minimum subsidy to assure that every family can afford at least a basic plan, allow consumers to shop across state lines, restore the freedom of people to choose the level of coverage that best meets their needs and budget, that they can change anytime they become dissatisfied. Wouldn't we quickly return to a situation where we had a wide variety of plans and prices that consumers could choose, healthcare providers that are attentive to consumer demands in a highly competitive environment, and cost just a fraction of what we're paying today?
There's certain features of that I think would be a real step in the right direction. Focusing more on ensuring rare, very expensive things, I think, is a reasonable goal. There are trade-offs associated with that, but I think there are some reasonable points there. Yeah.